Struggling to find shoes that fit because of your bunion? You're not alone. And there's more you can do about it than you think. My name is Dr. Andrew Schneider. I'm a podiatrist in Houston, Texas. After treating thousands of patients with bunions, I've discovered the right treatment approach can dramatically improve how your shoes fit and feel. What people don't realize is that you don't always need surgery to get relief. There are proven conservative treatments that can reduce pain, slow progression, and help you get back into the shoes you love. In today's video, I'm going to show you exactly what treatment options are available, how to determine which approach is right for your bunion, and what you can expect from both surgical and non-surgical treatments. You'll learn about custom orthotics, injection therapies, and when surgery might be your best option for long-term relief. But before we get started, please take a moment to hit the like button and subscribe to the channel with the notification bell. This helps others with bunion problems find this crucial information. And I post new videos every week with important foot health content. I also wrote a book all about bunions that I'm happy to send to you at no charge. Visit www.bunionbook.com to request your free copy. The first thing you need to understand about bunions is that they're not a cosmetic problem. A bunion is actually a complex deformity where the first metatarsal bone shifts outward while the big toe angles towards the second toe. This creates that characteristic bump on the side of your foot that makes shoe fitting so difficult. Many people think bunions are simply bone growths that can be shaved off, but that's not quite true. The bump you see is actually the head of your first metatarsal bone that's being pushed away from its normal position. And that's why treating bunions effectively requires addressing the underlying mechanical issues, not just the visible bump. The progression of bunions is typically gradual, which is why early intervention is so important. What starts as a small bump and minor shoe fitting issue can eventually lead to significant pain, difficulty walking, and severely limited shoe choices. The good news is that with the right treatment approach, you can often halt or slow this progression. Conservative treatment should always be the first line of defense against bunions, especially in the early stages. The goal isn't necessarily to make the bunion disappear, that's usually not possible without surgery, but rather to reduce pain, improve function, and help you get back into comfortable shoes. Custom orthotics are one of the most effective conservative treatments for bunions. They aren't the generic insoles you find at the drugstore, but precisely crafted devices made specifically for your feet. Custom orthotics work by addressing the underlying biomechanical issues that contribute to bunion formation and progression. The way custom orthotics help with bunions is by controlling abnormal foot motion. When your foot pronates excessively or moves in a way that puts stress on the big toe joint, it can worsen bunion deformities over time. A properly designed orthotic redistributes pressure, supports your arch, and helps your foot function in more normal pattern. For many of my patients, custom orthotics provide significant relief from bunion pain and make it easier to find comfortable shoes. The orthotic essentially creates a more stable platform for your foot, reducing the forces that cause the bunion to worsen and often alleviating the pain associated with the deformity. Shoe modifications and proper footwear selection play a crucial role in bunion treatment. The reality is that most shoes are designed for feet without bunions, which is why finding comfortable footwear becomes such a challenge. However, with the right approach, you can find shoes that accommodate your bunion while still looking professional and stylish. The key is understanding what to look for in bunion-friendly shoes. You need a wide toe box that doesn't compress your bunion against the side of the shoe. The shoe should be made of a soft, flexible material that can accommodate the shape of your foot. Avoid pointed toes and high heels, which force your foot into an unnatural position and increases pressure on the bunion. Sometimes, simple shoe modifications can make a dramatic difference. You can have your shoes stretch in specific areas to accommodate your bunion, or add padding to reduce pressure points. These modifications are often much less expensive than buying new shoes and can extend the life of footwear you already own. Bunion pads and spacers can provide immediate relief for many people. These simple devices work by cushioning the bunion or separating the big toe from the second toe. While they don't correct the underlying deformity, they can significantly improve comfort and make it easier to wear shoes. There are many different types of bunion pads available, from simple gel cushions to more complex splinting devices. The key is finding the right type for your specific situation. Some people do better with soft gel pads that cushion the bunion, while others benefit from more firmer spacers. Some people do better with soft gel pads that cushion the bunion, while others benefit more from firmer spacers that can rely on the toe. When conservative treatments aren't providing adequate relief, injection therapy can be an excellent next step. Corticosteroid injections can provide significant pain relief by reducing inflammation around the bunion joint. These injections are typically done in the office and can provide relief for several months. The injection is usually placed directly into the joint space or into the inflamed tissue around the bunion. While the injection itself may cause some temporary discomfort, most patients experience significant pain relief within a few days. The effects last about 3 to 6 months, and the injection can be repeated if necessary. It's important to understand that injection therapy treats the symptoms of bunions, the pain and inflammation, rather than the underlying deformity. However, for many patients, this symptomatic relief is exactly what they need to return to their normal activities and comfortable shoe wearing. Physical therapy and specific exercises can also play a role in bunion treatment. While exercises won't reverse a bunion deformity, they can help maintain joint mobility, strengthen the muscles around the big toe, and improve overall foot function. Simple exercises like toe spreads, marble pickups, and resistance band exercises can help maintain flexibility and strength in your big toe. Stretching exercises for your calf muscles are also important, as tight calves can contribute to the foot mechanics that worsens bunions. The timing of bunion treatment is crucial. The earlier you address a bunion, the more options you have, and the better your outcome is likely to be. Small bunions that are caught early can often respond very well to conservative treatment, while large, severe bunions may require more aggressive intervention. That's why I always encourage patients not to ignore early bunion symptoms. That slight bump on your foot and occasional difficulty finding comfortable shoes are warning signs that shouldn't be dismissed. Early intervention can often prevent the bunion from progressing to the point where surgery becomes necessary. When conservative treatments aren't providing adequate relief, surgical correction may be necessary. However, it's important to understand that bunion surgery isn't a quick fix. Recovery can take several months, and there are risks associated with any surgical procedure. The decision to have bunion surgery should be based on pain and functional limitations, not just appearance. If your bunion is causing significant pain, limiting your activities, or making it impossible to find comfortable shoes despite conservative treatment, surgery may be appropriate. There are many different surgical techniques for bunion correction, and the right procedure depends on the severity of your bunion, your age, your activity level, and other factors. Some procedures involve cutting and relining the bones, while others focus on soft tissue corrections. Modern bunion surgery has evolved significantly over the years. Today's procedures are more precise, recovery times are often shorter, and outcomes are generally very good when surgery is performed by an experienced surgeon. However, surgery isn't right for everyone. Patients with certain medical conditions who can't commit to the postoperative restrictions or whose bunions aren't causing significant functional problems might be better served with continued conservative treatment. The recovery from bunion surgery varies depending on the specific procedure performed, but most patients can expect to be in a surgical shoe or boot for 6 to 8 weeks. During this time, weight bearing may be restricted, and you'll need to keep your foot elevated frequently to control swelling. Physical therapy often plays an important role in bunion surgery recovery. Once the initial healing is complete, therapy can restore range of motion, strength, and normal walking patterns. The goal is to return you to your pre-surgery activity level with significantly less pain. One of the most common questions I get about bunion surgery is whether the bunion can come back. While recurrence is possible, it's relatively uncommon when the surgery is performed correctly and patients follow their postoperative instructions. The key is addressing the underlying mechanical issues that contributed to the bunion in the first place. This is why custom orthotics are often recommended even after bunion surgery. While the surgery corrects the deformity, the orthotics help to ensure the mechanical issues that could cause the bunion don't lead to a reoccurrence or problems with the other foot. The cost of bunion treatment varies significantly depending on the approach taken. Conservative treatments like custom orthotics and injections are typically much less expensive than surgery, though they may need to be repeated over time. Surgery has a higher upfront cost, but may provide more definitive long-term relief. Most insurance plans cover bunion treatment when it's medically necessary. This includes both conservative treatments and surgery when conservative measures have failed. However, treatments that are purely cosmetic are typically not covered. Prevention is always better than treatment when it comes to bunions. While some people are genetically predisposed to developing bunions, proper footwear choices throughout life can often prevent or delay their development. This means avoiding shoes that squeeze your toes together and choosing footwear that allows your feet to function naturally. For people with a family history of bunions, early intervention with custom orthotics can often prevent bunions from developing or slow their progression significantly. This is particularly important for young people whose feet are still developing. The key to successful bunion treatment is working with a podiatrist who can evaluate your specific situation and develop a comprehensive treatment plan. What works for one person may not work for another, so individualized care is essential. Regular follow-up is important to monitor the progression of your bunion and adjust treatment as needed. Even with successful conservative treatment, bunions can continue to progress over time, so ongoing monitoring helps ensure the problems are caught early. If you found this information helpful, please share this video on social media. Your simple share can help someone find relief from bunion pain and get back into comfortable shoes. Also, leave a comment below if you have questions about bunion treatment options. I do my best to respond. Don't forget to order my free book all about bunions. I'm happy to send you a free copy when you request it at www.bunionbook.com. If you're struggling with bunion pain or having difficulty finding comfortable shoes because of your bunion, don't wait for the problem to get worse. Schedule an appointment for a comprehensive evaluation. We can assess your bunion, discuss all your treatment options, and develop a plan to get you back into the shoes you want to wear. The link to schedule is in the description below. Thanks so much for watching, and have a great day.